After the first part of the conversations about women's health with Dr. Rekha Varma, we are coming out with our second part where we have interesting discussions on women's health. And one other thing is that, what usually women face after delivery is regarding breast milk.
Yes.
Yeah. So, how do we basically handle that?
Yeah. Actually, the feeding the baby in the right way, which needs a proper training from the family member, old ladies, or from the hospital itself. And in some people, because of maybe due to some health conditions, definitely the breast milk production is depending on the sucking reflex of the infant, actually, the baby. So if the baby is not properly able to suck the milk, definitely the baby will get irritated and they will switch over to the formulas, actually. So if the breast milk is less, and we can give medicines, which is there are a lot of medicines, and definitely the diet which the lady has to follow also has a big part on the production of the breast milk. And the medicines has Shatavari is the one which we can make it as a milk decoction, palkashayam, which will help to get more milk for that particular lady. Yeah.
Okay, because that is one concern everybody has got, in the sense.
Yes,
Oh,
lot of people.
yeah, and in the absence of breast milk. Okay, so now people have slowly started shifting to formulas, and
Yes,
but according to Ayurveda, they have told goat's milk is probably the one that is
same quality of breast milk. Yeah.
quality. So what is the difference when you look at the formula and probably goat's milk? What would be the difference?
Yeah. Actually, the breast milk contains lot of immunity contents, or the active ingredients to increase the immunity when the infant in the infant stage and the growing age also. So immunity is a big thing which we all are hearing. Definitely after COVID, we are hearing about immunity always. So
Yeah.
breast milk definitely has a immunity developing or modulating factors. And
Sure.
formulas, actually, it is easy to give to the child, infant, and easy to take also. He can take it or she can take it from the bottle easily. But it has its own
Convenience.
problems. Yeah. So
Convenience.
yes. So the thing is, it has its own side effects. Not side effects, actually. The digestion of the formulas is sometimes for the child. It is difficult. It can lead to constipation and other colicky pain and all. So more than all these, the immunity part of the child for the future has to get from the breast milk. So promoting breastfeeding is the one which we have to do along with the postpartum care at our centers.
So in totality, so why do we say that? How do we say that Ayurveda basically is one of the best approaches for women health?
Yeah. See, a girl child is becoming a woman when she attains the menarche or the first period. So from that age, she is physically a woman, may not be mentally. So from that age, each phase, that each conditions, for example, for a teenager, the problem may be acne, and there may be a lot of missing periods or irregular periods, colics during periods. All those things can be managed with Ayurveda. And during the youth phase, they will be going through the PCOS conditions and all. And the other one is pregnancy, then after delivery, then perimenopausal area, and the phases geriatrics. See, in all these conditions, Ayurveda is giving more importance to, in the Swastha definition, we say that it is Prasanna Atma Indriya Mana. So, the attaining Prasanna Atma Indriya Mana, along with the body health, all these things has to be compromised or has to be attained
Taken
to
care.
become a swastha or a well-being. So Ayurveda emphasis on this part, and other than giving just a formulation or a medical herb or medication, we make sure that the whoever is coming to Ayurveda for any of these conditions, we give maximum care by attaining these three parts actually: Atma, Indriya, Mana, and making sure that the Agni is in the proper way, and that is digestion is the proper this thing, and metabolism. So in for a woman is the one other than men passing through different phases of life in different phases in her life. So each part has to be managed properly with Ayurvedic care, and Ayurveda is the best way to deal with all these, because most of these are not a disease actually. These are all phases in life. So for going through the phase in a smoother way, Ayurveda will definitely help.
So, in your practice, as far as women go, uh, what all chronic diseases have you seen? In the sense, it could be most of the things what women come with is arthritis, or So, what kind of diseases do you see more in women rather than in men?
Yeah. See, more in women, the main conditions other than this gynecological and other things, I used to see as degenerative conditions actually. We know that our Asti Dhatu is growing till the age of 35, 33, 35. After that, it is just Chaya of Asti
Yeah,
Dhatu
yeah.
is happening. And our estrogen level has a pivot role in this managing this Asti Dhatu, that is the building up of the bones. So once we attain or we are going through the menopausal part, estrogen dip of estrogen is happening, and that definitely will create more problem to the bones, thinning of bones. We call it as osteopenia, the first condition, and when it progresses, definitely it is a progressive condition. When it progresses, it is osteoporosis, and this osteoporosis definitely will give more problem to the joints, especially the knee joint, shoulder joint. So all the degenerative arthritis are more in women than men, and that is the more case. These are the more cases which we used to see, especially the shoulder and the knees. These are the two things we are seeing for more in ladies.
Okay. Is it because that women actually don't give too much of priority to their own health, or do they
Yes.
ignore it, or are they more susceptible, or both?
Both, because they are definitely, even though we are progressing in all the aspects of the life, our life, in this new time or new generation time, women, they are less, still they have to improve the self care. Actually, self care is not the for most of the women, but some people are there, they are taking care of their health properly, but some most of the women, they are giving, they are least bothered about their health. And when it comes to a stage that it should be managed medically with medications or other interventions, only they will come for consultation, and then the doctor will be in a condition that he or she has to manage the condition, but there is a limitation because of the chronicity of the disease. So that is one reason. And the second one is, as I said, the osteoporosis, osteopenia is more in women, and degenerative changes are happening more in women.
Okay. So, for a woman who is basically getting into that age, I mean, 50 plus, as we call, slowly, after periods, probably she's getting into the vata stage.
Yes.
So we know that tatra asthinosti, vata is in asti, and when vata goes up, the quality of asti goes down. That's why
Yes.
women get all these asti issues. So, is there something which, it might be a small tip, is there something which a woman can probably consume on a regular basis to stay healthy?
Yes.
Is there something?
Regarding the bone health, consuming more sesame is one, and the almonds will help definitely. That also will help, and more of pulses other than the black chana, the other pulses they have to take on a regular basis, and they have to give more care for the body by giving oil application on a regular basis, and periodical detoxifying treatments according to the rutus they have to do, and that
Seasonally.
definitely will keep them healthy in their time.
Milk also is good, right? Drinking milk regularly.
Yes.
Yeah. So, since you have been practicing for about 30 plus years, yeah, 30, yeah, this is your 30th year. Yeah, 93
Yes.
means this is your 30th year.
93.
Wow.
Yeah, yeah, 30th year.
So, see, you would have actually, as you said, you have worked in different places. So, do you have some, like we call, the kitchen tips or grandmother tips, which they say, which they say, okay, you do this, which you can probably share, as far as women health go.
Yes.
Remedies like, home remedies.
Yes, yes, yeah. This, as I said, the sesame is a great role in women's health, especially during the period time. If they're missing the periods, the elunda, that is the balls, sesame
Eldunda,
balls with
sesame with
jaggery, yeah,
jaggery,
that is very good.
little bit of dry ginger.
Dry ginger, that is very good. And the second one is this fenugreek, that is uluva, we call in Malayalam, methi.
Fenugreek.
So that seeds has the decoction of that that is keeping the uluva or methi seeds in water for overnight and taking it is very good for this leukorrhea, and even for proper menstruation and to avoid menstrual cramps. And we use grandmothers used to suggest cumin seeds, that is jeeraga,
Jeera.
as a decoction if there is a cramp during menstruation. And definitely doctors, we used to add dhanodram tablet to that decoction to relieve the menstrual cramps.
And I think Hingu or Hing is probably one of the best painkillers as far as cramps go, also, if I'm right.
Yes, kingo also. Yes.
Hingu. So that's the reason, one reason why in those days, for every dish, people add
Yes.
a lot of Hing.
Yes.
Okay, so see, off late, there are a lot of talks about menstruation and do's and don'ts during menstruations. Even though we haven't seen so many things, the do's and don'ts about taking shower, okay, during
Yes.
menstrual, whether should we take a shower or should we not take a shower. So how would you look at it from an Ayurvedic perspective about shower?
Yeah. Okay. Taking shower during menstruation. Actually, the menstruation is the phase where shedding off the lining is happening. In that phase, the pitta vada predominance is happening. And if we are taking a cold water bath, detailed bath, definitely there is a stampana which is happening for the pitta. And along with that, the shita water, that is the cold water, will aggravate the vata in the body. So bath should be taken because it is a hygiene part, but it should be a quick bath with lukewarm water. That is the one which we used to suggest.
A quick shower,
Quick shower,
not a
not
detailed
a
bath,
detailed
the
shower.
body cools down.
Yes,
And even, they are usually ask them to sit idly in a place and not do too much of physical activities or run around, right?
yes,
So
yeah.
what would be the reason for that?
Yeah, because vyayama, that is the overdoing or doing exercise, is the one which is there for reducing the kapha, aggravated kapha in the body. And when we do this particular vyayama, or doing too much of exercises during period time, definitely this vata and pitta gets more
Increased.
aggravated, and that will create more problem and cramps and other body pains and tiredness. All those things will happen.
And probably flow also might go up when the
Flow,
pitta
flow
goes up.
go down. Yeah.
So that is nice. So you see, somewhere we see, as children, we have understood, we take our mothers and our sisters' health and all those things for granted. As we age, it so happens that men, from my side, I can say that we are many a times we are dependent on the women around us.
Yes.
Even though the men project themselves very very independent,
Mm.
somewhere they are dependent on the woman.
Yes.
So uh, I probably feel that the health of the woman is basically the health of the family,
Family.
right?
Yes. Yes.
So how do you want to throw light on that?
Yeah. Yeah. See, women's health. See, for example, if the woman in the house is getting affected with a simple cold, the total equilibrium of the house will go. The child
Kitchen
will
gone,
miss.
no
It is
kitchen.
gone. Yes, the child will miss the her bus, school bus. The tiffin is not ready, and the house will be a mess. And for a simple cold, actually, simple cold cough, it is happening. So the whole house, that is the central point of for our earth, there is a central point access like that for house. The central point is definitely woman. So taking care of women's health is the integral part of healthcare system, and definitely we have to concentrate on that. As doctors, we have to teach them how to take care of the health and health, the total health of the family, along with taking care of the health. So I think women's health has to be managed, not as a not only the gynecological conditions, the overall health has to be managed as a separate part of the healthcare system.
So, as we say, the health of the woman is the health of the
Health
home.
of the family, the home. Yes,
Okay.
definitely.
Yeah. So, thanks a lot. So, what last would you want to tell our viewers, or listeners? The last tip, whatever you want to say about women and women's health. Is there anything else you want to share?
See, women definitely, as I said earlier, women, they are taking care of the health. Self care has improved than previous years, but still they are hesitant to come for a medical help or checkup. And 50% of the population of women actually. So what I want to tell is they should approach a expert in any system of the medicine for if they are facing any of the physical conditions and mental conditions, or mental stress or anxiety or anything, not only the physical conditions. So they should come forward, and they should take care of the health, because the health is the family health. Depending her health, the family, whole family is running. And always the other people in the family should always think that she is the one who has to be taken care more. So that has to happen. And I think we can definitely help them with our system, and improving the
Yeah.
total health of the country and population.
Yeah, and awareness that Ayurveda
Yes,
can also
awareness.
contribute, in a holistic way.
Holistic way,
Yeah,
yes.
people should understand that it's not only about the see. Yes, modern medicine, definitely imaging and all those things will definitely help. But
Yes, for screening, definitely
yeah, yeah,
help.
taking the whole body and holistically handling Ayurveda can actually contribute. And even Ayush government of late has actually done a lot of things to promote women health through Ayurveda.
Yes.
Yes. So it was nice talking to you.
Thank you.
Okay. So we'll definitely catch up.
Sure.
Okay. We
Thank
will,
you.
yeah, yeah, a lot of things to discuss about women and women health. And I know that you are the expert there. Okay.
Okay.
Yes. See you soon. Take care.
Yeah. Thank you. Thank you.
Bye.
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 Bye. Hope you're enjoying this conversation. Come back for the next part.